Physiological Correlates of Human Behavior, an intro to behavioral neuroscience. With me, Dr. Andrew T. Ainsworth, Professor of Psychology at California State University, Northridge. Part 2, Motivation and Emotion, What Makes Us Go? Lecture 5, Drugs, Addiction, and Reward. Section 1, Terminology and Drug Classes. Hey, I'm just hanging out in the Lightboard studio in between takes, and sometimes when I'm trying to unwind, I'll pick up a good book. Now, I've been a pretty voracious reader since I was little. I read through a bunch of books, and I have boxes and boxes of books I've read. I don't read as much as I used to. I think things like books on tape and stuff like that tend to listen more now as I'm driving or doing yard work or something. But this chapter about drugs and addiction did get me thinking about some books I've read in the past. So this is Fear and Loathing in Las Vegas. I read this book a long time ago, but when I wanted to read, I think I'd lost a copy. I bought this one that's got the movie cover on it. That's Johnny Depp there. So it was turned into a movie, and it's a pretty good primer and does a pretty good job covering various kinds of drugs and various types of states of intoxication. So if you're curious about drugs and drug use, it's a pretty good watch. And you get to see sort of what it's like to be on drugs without actually taking drugs. It's about the closest you're going to get. So if you're curious, it's a pretty good one. I was also reminded of another book that I read. This one's a bit more dense, but it's a thicker book. This is The Electric Kool-Aid Acid Test by Tom Wolfe. Now, I've not heard of this one. Tom Wolfe's a pretty famous author. Maybe this is not one of his better known books, but the back says, the Electric Kool-Aid Acid Test is not simply the best book on hippies. It is the essential book, the pushing, ballooning heart of the matter, vibrating dazzle. So this is a book mainly about LSD, but lots of hallucinogens. And in the words of Steve Poltz, who's a songwriter, The Electric Kool-Aid Acid Test is a novel by Tom Wolfe. It's about taking LSD and driving across the country, driving a school bus on LSD, the way an education ought to be. Anyway, so if you're interested in hallucinogens and the effects it has on people and learning more about that culture, this is a really good book too. It hasn't been made into a movie, but I feel like reading it's a pretty good book. Anyway, we're going to talk a lot about drugs. It's a pretty big lecture. I think it's 6 sections. So, strap in. Let's start talking about drugs and drug classes today. And I hope you're excited. Hey, it's Dr. A. We're starting our biggest lecture, which is lecture 5. It's all because there's just a lot of drugs to cover. So we're talking about a lot of stuff. So let's get started. This is section 1. Addiction. Drug. Agonist. Antagonist. Psychoactive drug. Drug addiction. Withdrawal. Dependence. Tolerance. Analgesic. Hypnotic. Euphoric. Psychedelic. Anxiolytic. Sedative. Controlled substance. Controlled substance schedule. Narcotic. And drug classes. So that's it for section 1. Let's get to lecture. Hey, Dr. A here again. Today, we're going to talk about drugs, addiction, and reward. Now you're probably thinking, man, it's about time to get some good stuff. I'm talking about brain a lot. Let's talk about some behavior, right? Let's talk about some things that we do, things that make us human.
That's what we're talking about. We're going to start today with section 1, which is on just some terminology, and we'll talk about some drug classes. This is all part of like part 2 of the course, which is getting into motivation and emotion, basically what makes us go, into all of our drives and emotions and everything else. That's what we're doing today. Let's get to it. Now, let's first talk about addiction a little bit. We throw the term addiction around quite a lot. Talk about all kinds of behaviors that we have, whether it's about, addictions to video games or drugs or food or shopping or gambling or all kinds of stuff. And sometimes, I think it might be a little bit of overuse of the term to the point where it's sort of become a little bit watered down. But also, I think it's because there's lots of things that we do that fit that category. So when you have a need or urge to do something or use something, even if it causes harm. Now that is a little bit generic. The harm could be to you, could be to other people, could be all kinds of things can be harmful. But there are types of addictions, including substance addiction, which is what we're going to talk about in here. Things like alcohol or smoking, different kinds of drugs. There's also non-substance addiction, such as gambling or like online shopping or lots and lots of things that fall into this category. Video games, anything that sort of triggers these sort of pleasure centers in our brain could lead to an addiction. And the drugs that we're going to talk about can be addictive regardless of whether or not they're legal. Most people think like, addictive drugs must be sort of illegal ones, legal street drugs. Those are the addictive ones. No, there's lots of drugs that are perfectly legal that people use all the time that are perfectly addictive. So I myself, I'm super, super happy that I don't have any addictions whatsoever, because if I did, that would be really, I think, frustrating for myself to, have to be addicted to something. Hold on, I'm a little thirsty. So I'm happy that, there's no drugs or anything that I'm addicted to, because I don't know how I can handle it. So we use the term drug often to refer to all kinds of stuff. Or when we say drug, we mean something that's prescribed by a doctor. We're talking about street drugs, or we're talking about any number of things. Sometimes there's certain things that don't sound like drugs. Like when we talk about drugs, do we include alcohol in that? Is stuff like nicotine or caffeine, things that occur in our food and drinks and things, are those also drugs? Well, a drug is a medicine or other substance that changes the body's functioning. So we're going to use this term to really as a broad use, so things like nicotine, caffeine, and coffee, and those kind of things, all those would be considered drugs. They do have and do affect the body's functioning. And we've mentioned this before. I'm just bringing this up again just as a reminder that we can talk about drugs in lots of different ways. Lots of different ways to categorize drugs. We can think of them as agonists or antagonists, where an agonist is a drug or something, anything that mimics or enhances the effects of some kind of neurotransmitter. So lots of neurotransmitters, naturally occurring chemicals in our system, and these drugs actually go through and will mimic the effects of those drugs, and either by producing more of it or leaving more of it in the system, eliminating reuptake, or it'll bind directly to the receptors and pretend act like the drug themselves and mimic it directly. And we also have antagonists. Now, antagonists block receptors or decrease the availability of neurotransmitters by either reducing their production in the presynaptic cell or by reducing the release. So they may have a lot of neurotransmitters in the cell, in the axon, but it can't release it. Somehow it's getting barred from releasing it into the synapse. All right, so agonists, antagonists. Those are important because as we talk about different drugs, we can start talking about how they work on the body. And these are two different ways that they're going to have an impact on our system. Most of the drugs that we're talking about in here, in this lecture, are going to be psychoactive drugs, which means they're drugs that affect mental processes and behavior. There are drugs that affect behavior that aren't necessarily psychoactive. I'm trying to think of an example, like something like steroids, right? Where it affects the body and affect behavior. Actually, I guess that's not a really good example because that does actually affect mental processes somewhat, but that's not why people take them. I would say psychoactive drugs are those that at least some purpose of the drug is to actually, affect the mental processes of behavior. Anyway, there's lots and lots of these kinds of drugs, like drugs with psychological effects such as anxiety relief or hallucinations or relaxation or sleep or all kinds of stuff are all going to fall under this sort of psychoactive drugs. I guess a better example of what isn't a psychoactive drug is something like taking Tylenol. Right? Tylenol is not, doesn't, it just, helps to maybe lower some, give you some pain relief, but it's not going to make you feel high or any of those other effects that oftentimes come with psychoactive drugs. Another example would be something like an antibiotic, where the antibiotic is helping us to get rid of a bacterial infection or something like that, but it's not having necessarily a psychological effect on us that wouldn't really be considered psychoactive. Now, as you can tell, the definition is a little bit blurry, a little bit gray, but most of the things we're going to talk about here are things that people are taking with this purpose of trying to impact their mental processes and behavior. So, of course, we put a lot of this stuff together. You get drug addiction. So specifically, addiction as it occurs to psychoactive drugs. So preoccupation and compulsive use despite adverse consequences, and a high tendency to relapse after quitting. So we talked about this before, harm and consequences. Part of addiction is that you do whatever the addiction is. If it's a drug addiction, you will think a lot, right? You're going to be very focused on the drug, keeping the drug on you, being able to get your next drug if you're running out of drugs. It becomes it's at the forefront of every thought. So it's a preoccupation. And you use it compulsively, meaning that you can't stop yourself from using it. You have to continue using it, despite it having adverse consequences. Like drugs there's all kinds of adverse consequences that come with drugs. And they vary from things like, like smoking cigarettes can make you smell like cigarettes, and that might be an adverse effect. But it could also be something to the point where you're so focused on the drug that you lose your job, you lose your house, you lose your everything. You're living on the streets now, just trying to get the drug. So you're so preoccupied with it that you ignore every other consequence. And then when you try to quit, the chances that you will relapse and go back to the drug are actually pretty high. That's actually a fairly good sign of a drug addiction as well. Addictive drugs produce some sense of pleasure in one form or another, at least initially. So I say initially because oftentimes the reason why people take the drugs in the first place is because of the high, because of the pleasure that they get from taking the drug the first time. Lots of drugs, though, have other things going on with it that make it sort of complicated, where after the initial use or initial few uses, you might develop some tolerance where you don't quite feel the same euphoric high anymore. You start to develop things like withdrawal symptoms when you try to quit taking it, or when you can't get the drug fast enough. And you also develop some kind of dependence on the drug that now you have to take the drug not to feel high or feel good, but just to stop feeling bad. Just to keep yourself feeling normal, you need the drug, and that's sort of a part of the drug addiction cycle. We'll talk more about in a second. So I mentioned a couple of terms there, withdrawal and other things, but let's go into it. So withdrawal is a negative reaction that occurs when a drug is being stopped. So you're taking a drug. Again, when I say drug, when I'm taking a drug, I'm saying it very generically because it could be, again, you could be drinking alcohol, you could be taking pills, you could be smoking something, you could be injecting. All those things are part of it. So when I say taking a drug, it sounds goofy, but when you're, talking about all these different kinds of drugs, this is the most generic way to say it. And so as you're sort of using a drug and then you stop using it, it'll cause all kinds of bad effects in the system. So these are like negative reactions. So the nervous system, the NS, the nervous system will adapt to the presence of the drug. So you have the drug in your system, and it's now, your body's getting used to it being there and adapts to it. So when you take the drug away, your body then isn't going to function the way it's supposed to, because that adaptation is now shifted. You're no longer working the way it's supposed to with the drug in your system. And oftentimes the withdrawal symptom they'll have the opposite effect of the drug. So if a drug, like something like an opioid, tends to make you constipated, when you stop taking the drug, well, you're going to get diarrhea. It's going to be the opposite. If something makes you feel euphoria, like happiness and a sense of pleasure, the withdrawal symptom is likely something like depression. right? And oftentimes when we think about withdrawal symptoms and stuff, we're thinking about something like this gentleman here, who's going through some fairly severe withdrawal, and they're trying to kick the habit and all this stuff, and we see this a lot in movies. But it doesn't have to be a withdrawal symptom. It doesn't necessarily have to be that. If you're someone who drinks caffeine quite a lot, if you have coffee quite regularly or drink energy drinks have a lot of caffeine in them, what happens when you don't for a day? How do you feel? Well, one of the most common things, you get headaches, right? So because the caffeine is affecting your body that way, when you stop taking it, it can trigger actual headaches. And caffeine is one of the things, if someone who's prone to headaches, they'll actually give them caffeine to help fight the headache. So one of those back and forth things. So again, you can have withdrawals just for something simple like that. Just getting a headache from not drinking your normal, cup of coffee during the day is a withdrawal symptom. All the way through, like if you're withdrawing for something like heroin, it feels more like the flu. You're sweating, you got body aches. It's a whole lot of other withdrawal symptoms going on, but not all withdrawal symptoms are super severe like that. Again, still talking about some drug terminology here. What do we mean by dependence? So drug dependence, we hear that term quite a lot too. And there's a bit of a controversy about different kinds of dependence we might have for drugs. But a dependence is the need to keep taking a drug to avoid withdrawal symptoms. So I said this before, this is one way of thinking about it, is that once you start taking a drug, you become dependent, because when you stop taking the drug makes you feel bad. You get a headache, you get, you start having flu-like symptoms when you stop taking the drug. There's certain drugs that if you stop cold turkey, you actually can die from it. And we'll talk about that shortly too. But the dependence comes because you take drugs, you take a drug for a long time, you use a drug for a while, and then as you get used to the drug, your body, it gets accustomed to it. When you stop taking, you feel terrible. So you're like, well, I better take it to then feel normal. So you get in this cycle of now you have to take the drug, not to feel great, not to feel really good, but just not to feel bad. And that's the sort of general cycle of dependence with a lot of psychoactive drugs. I just want to avoid the withdrawals. And that's what keeps people sort of going. It keeps them addicted. They want to avoid the lows that come with dependency. There's different, it can be broken down into physical dependence and psychological dependence, where, like I said before, the physical dependence, you have things like headache and difficulty breathing and a racing heart and other stuff as you start to not take the drug in a regular dose. And there's also psychological symptoms where you start to feel anxiety. Oftentimes that anxiety is around not being able to get the drug again or not being able to take it. Like this, it's like an anxiety about, oh my God, where am I going to get that next dose? But it could just be, as it starts to leave your system, your sympathetic nervous system could start to kick in, and all of a sudden now you start to feel that fight or flight system that's been suppressed for a while by the drug. Again, if the drug produces a sense of euphoria, like you feel like you're floating and high and everything feels great, as you come down off of that, you're going to feel some depression. It's not the psychological effect, but it's that psychological effect that could arguably be tied to a physiological one, that your brain chemistry is changing and triggering depression. Okay, and even things like insomnia. If you're taking a drug that helps you sleep, and when you stop taking it, it's likely you have trouble sleeping. But that also could be a psychological effect too, because you're just thinking about that preoccupation with the drug. The reason why I mention this is there's lots of controversy over different kinds of drugs and whether or not they really create a physical dependence or it's solely psychological. And we'll talk about this more later on, but there was oftentimes, if you read about things like marijuana, where they would say there is no physical dependence with it, so therefore it's not addicting. But if you've known anybody that's ever been a sort of regular user, there's lots and lots of psychological dependence where they feel like they can't really function unless they are high, unless they have that in their system. So, it's a little bit of controversy, but I think that there's most of the drugs we're going to talk about here have some form of dependence, whether it's a physical reaction to not having the drug or just your preoccupation and feelings of anxiety and depression stuff because you're not taking it. the distinction is not super clear and it's sort of descriptive. It's not real useful because they start to blur, right? Both types of dependence have a physiological basis. So it's kind of hard to really argue the two and come to some real conclusion. Addiction and dependence often occur separately. So think about that for a second. You can become addicted, like preoccupied and go through the addiction process. And then the dependence, your physiological reaction where you're trying not to avoid withdrawals don't necessarily have to be one and the same. They can happen independently or at least separately. Can occur without the other. You can become dependent on a drug even though you're not necessarily addicted to it. Like you don't think about it all the time, but you feel like crap, so you have to take it because of the dependence and vice versa. What about tolerance? Tolerance is a word that gets used in different ways all the time. Like we talk about tolerance for other people. Like there's like the Museum of Tolerance. It's about sort of being able to live and let live with other people. This tolerance is a little bit different. It's about talking about the degree to which your body starts to require more of a drug to feel the same effect. You see this a lot in movies or stories you might hear about drinking, where people have like drinking contests and one person will try to drink the other person under the table and stuff. Well, it's really a display of tolerance, right? So as they're drinking alcohol and trying to outdrink the other one, they're both trying to display that they have more tolerance than the other person does for the alcohol. So as you're able to drink more and more of alcohol and feel less drunk or less intoxicated, that's because of the tolerance that you have developed for alcohol in your system. That same kind of thing goes for most drugs, where the more you take them, the more of it you have to take in order to feel the same level of intoxication or euphoria or whatever effect you're looking for. And that's tolerance. And people talk a lot about how men have higher tolerance for things than women do because of physiology. People talk about different cultures have different tolerances for different kinds of drugs and alcohol. So there's all kinds of talk about the different levels of a drug needed in each person and how much it takes for them to actually feel the effects. Right? Someone who drinks a lot, it's going to take a lot more to get drunk. Someone who does, who takes a pain medication like an opiate or something like that, it's going to take a lot more of it to feel the same level of euphoria that they used to get with just a smaller dose. That's how it is. So why do we develop tolerance? Well, it's a compensatory reaction in your system. What that means is that your system compensates, again, for the presence of the drug, and it adapts. So your nervous system's adapting to the presence of the drug, and as it does that, your system shifts to accommodate the presence of the drug. Well, now at that same effect, you need more of it. Your body then it compensates, adapts more. You need more, and it keeps on going. Due to the lowered amount or sensitivity, or the number of sensitivity of receptors, so your system, knowing that if the drugs in your system is constantly stimulating some receptors, or your body's going to then lower the number or how sensitive those receptors are in your system, it's going to respond. Which is why when you stop taking the drug, now you have too little receptors, and now you feel terrible. You can't get the same reaction you used to. It also will produce more, more metabolizing enzymes. So there's lots of enzymes we use to put on in our system to get rid of drugs out of our neurotransmitters out of our synapses. So we start to make more of those. Knowing that there's more in our system, our system starts to develop more of those enzymes, and it starts to get them cleared out quicker. And also, there's more reuptake that'll happen if we're stimulating something and it's releasing more neurotransmitters. Well, we'll also start to produce more reuptake in order to get rid of those things out of the system too. So your body starts to adapt to the presence, and that's why you need more now to get to the same level. Right? This is also what can lead often to overdose, because this can develop in response to just the pleasurable effects of a drug. So the term is like chasing the high. You're always trying to chase that high, that initial euphoria you got from taking the drug. So now you're chasing after it. You can't quite get there. So you're taking more of the drug. Your tolerance increases. You take more of the drug. Tolerance increases. You take more of the drug. tolerance increases. Well, at some point you get to a point where you've taken so much of the drug that it starts to shut your system down, and it can cause an overdose, can lead to death by overdose. Okay. And that's also because the more drug you need to get the desired effect, and it may be because you have a tolerance to those effects, that the pleasurable part, but you may not have developed a tolerance for other effects of the drug. So even though you're chasing the sort of high from the drug, your body's not developing a tolerance to the negative side effects and everything that's doing to your body. Like, for instance, as you increase doses of heroin to achieve that euphoria that you start off when you first did heroin, the first time, the sleep and respiratory arrest that can accompany heroin, you don't develop a tolerance in the same way. It remains undiminished. So at some point, you can actually just eventually going into a coma-like sleep and going into respiratory arrest, and that could cause your death due to the overdose of heroin. So taking more of that heroin leads to these things because the euphoria, you've adapted to the euphoric effects, but not to these negative effects of heroin. What about more terminology that we'll throw around here too, which is different kinds of drugs. You got analgesics, hypnotics, euphoric drugs, psychedelic drugs, anxiolytic drugs, sedatives. There's lots of terms for describing drugs, and that's based on the drug's effect. What is a drug doing in your system? Well, if it's an analgesic, it means it's removing pain, right? It has a anesthetizing effect in your system, right? So an analgesic is something like morphine that's going to cause a reduction in pain. A hypnotic is something that actually induces sleep, right? So we want more. We're trying to sleep. A hypnotic drug is something that's going to induce sleep. When I think of hypnotic, just as association, I think of they're at this circle, count backwards from 10, actually like hypnotizing somebody. And in a sense, it is like they're drugs that actually help to put us into a state of sleep, to sort of hypnotize us in that sense, right? That's what they're called, hypnotics. And then you have euphoric drugs. This is a description of any drug that triggers euphoria, feelings of sort of happiness and ecstasy that the drugs can make you feel. And then you got drugs that are called psychedelics, sometimes called hallucinogenics. These are drugs that cause hallucinations, right? They're also known as hallucinogens. They cause changes in perception, thought, and emotion. They trigger things like perceptions that have no external trigger, meaning that you're seeing things that aren't there. You're hearing things that don't exist. Okay. I think of, this is unlike the one above. As you sort of move your head around, move your eyes around. This one, I think this is actually harder to look at than the other ones. But so let's quickly talk about this. We also got the anxiolytics are those that reduce anxiety, and sedatives are drugs that relax. Sometimes sedatives and hypnotics can be sort of interchanged because drugs that oftentimes will help you relax are also those that help you go to sleep. But a sedative is something that helps to relax somebody and are given to people that are under high stress to make them relax. All right. Enough of looking at that thing. This is giving me a headache without withdrawal. As you hear people talk about drugs, you hear different terminology. Sometimes this is legal. Sometimes you might hear on the news or hear people talking about it in terms of medical uses and that kind of stuff. So oftentimes you hear things called a controlled substance. So controlled substances, they're drugs that are regulated, or some kind of regulation has been placed on the drug, and the drug has been put on a schedule. Now, the term schedule is kind of a weird choice of term, but it just means it's been put into a category of the kind of drug it is and how much control or restrictions are placed on that drug. Some of these are always illegal. So Schedule 1 drugs typically are those that are illegal because they're considered to have no medical purpose. So you have drugs like cocaine, heroin, different kinds of methamphetamines that are always sort of Schedule 1, right? Because they're always, the schedules are based on the balance between the usefulness of the drug and the tendency for the drug to be addictive. So if a drug is highly addictive but has very little medical use, it's going to be a Schedule 1 and is usually prohibited under all circumstances. Okay. Others are prescription drugs such as painkillers, things like morphine and oxycodone, that may be on a different schedule than, say, heroin, even though they're as we'll talk about, they're chemically very similar. They're going to be put on different schedules because they actually have prescription drug use. Like the risk of addiction is balanced out by the medical usefulness of the drug. All right. So these are oftentimes requires prescriptions. And if you have these drugs in your possession without the prescription, it's also illegal and for most of these schedules as well. Okay, so let's talk about those. So the controlled substance schedule is the list of drugs. It's continually being updated and things change quite often. And there's a bit of a push and pull that happens between the federal government. I'm talking solely about the United States. It's different in other countries. But in the United States, we have the federal government, federal regulations on these drugs. And then each state can have different ways in which they approach the schedule of controlled substances. And I'll talk about that, especially with marijuana, because the federal government, like currently, the federal government, it's still a class 1 or schedule 1 drug, but in California it isn't. California has legalized it, so it's no longer a schedule 1 drug. Anyway, there are 5 basic classifications or schedules of drugs based upon the balance of addictive ability and medical use. Right? If it's really addictive, no medical use, it's in schedule 1 or 2. If it has some medical use and the addictability gets lower, you get schedule 3, 4, and 5 is the least addictive, most medical use drugs. Let's talk about this a little bit. So this is how they sort of decide what's going on with these schedules. So this is the Controlled Substances Schedule based on the Controlled Substances Act, right? It was first started in 1970. We can spend a whole lot of time talking about the history and stuff and like the war on drugs and all kinds of things that have gone on in the United States that have both been impacted by this and have impacted it over time. But this is sort of where we are now. Okay, so there's 5 schedules. If the chance for abuse of the drug is high, like here, high abuse, and there's no medical use for it, the drug is not safe to use even under medical supervision, and that is a Schedule 1 drug. And pretty much any Schedule 1 drug is illegal to have or to use. Okay. For Schedule 2, here it's still high chances of abuse, but it has been used under medical restrictions or medical supervision under severe restrictions, and it has been shown to be useful. Things like morphine fall under Schedule 2. Okay. This drug can cause severe physical and mental addiction, but it is useful, especially a lot of times with morphine. They'll use it with folks with cancer, or if they're sort of at the end of life in like hospice care. You may find that they'll give them morphine because it keeps them comfortable, and they're not really worried about the addiction to it becomes a lot less worrisome at that point. You get to Schedule 3, you're now talking about the chances for addiction are fairly medium, which is, strange term, but it just means that the chances, this is all relative, the chances for addiction are less than, say, Schedule 2, but more than Schedule 4, right? So it's sort of in the middle. There's lots of medical uses for this. Abusing the drug can cause severe mental addiction or moderate physical addiction, just like this one, but the usefulness in medical settings has now become, it has more use in under medical supervision. And it just keeps going. If it's moderate, that means you're going for medium. This has less chance of abuse and addiction. And the medical has medical use. Again, it still can cause these things, but it's no longer as severe. Right? So we're not talking about, a moderate addiction. Just like with Schedule 5, the chances are more mild in terms of an addiction. All right, so that's basically how they figure out the schedule. So let's talk about some examples of drugs that are each of these schedules, so you can see what's going on. You see, these are all drugs that are generally illegal all the time, no matter what. And of course, I have a little asterisk here because this one's an interesting one because this schedule is based on the federal regulations, like DEA. But marijuana in California does not fall under Schedule 1. It's not, it's been, changed. I think it's off the controlled substance list for the most part, and is no longer a Schedule 1. Anyway, the way this also works too is like, this is illegal all the time. These schedules, 2, 3, and 4, for the most part, require prescription. Schedule 5 are things you can get without prescription. But again, some of that's not always cut and dry. It's a little bit of gray area, some of those things. But MDMA is another name for ecstasy. We'll talk about later on. First, we got heroin. LSD is lysergic acid diethylamide. Anyway, that's the LSD, from the 60s, hallucinogenic. Marijuana, we'll talk about later too. Methaqualone. This is like Quaaludes. Methaqualone, another drug that's again not used medically. Peyote is from peyote is like a mescaline, or both that are naturally derived. They're Schedule 1s. These are interesting because they are illegal for the most part, except certain Native American tribes use these for ritualistic purposes and things, and they're actually allowed to do so. But for anybody else, they're Schedule 1, illegal substance, controlled substance. Schedule 2, you got things like cocaine, methamphetamine. It also matters too, is that sometimes it goes from the way the law works too, that like being caught with a Schedule 2 drug is less of an offense than Schedule 1. So it's not like cocaine is being prescribed by doctors very much, nor is straight up meth. But again, if you are caught with these without prescription, it can be a Schedule 2 controlled substance offense. Anyway, cocaine. This is methamphetamine, like meth. Methadone, we'll talk a little bit about too. This is a synthetic opioid that was used or was developed to treat opioid addiction. So like if you're someone who's addicted to morphine or to heroin, methadone is the thing they'll use to help you get off of those drugs. You got hydrocodone. So it's hydrocodone in this sense, and hydromorphone and oxycodone. These drugs are like your Vicodins, your Percocets. These are pain medications that are prescribed but are still highly addictive. This is meperidine, fentanyl, dexedrine, Adderall, Ritalin. These down here, interestingly enough, these are prescription names, Adderall and Ritalin. These are also forms of methamphetamine. So even though I'm saying methamphetamine, like who's prescribing meth? Well, they're not, but they are in terms of this is. I know Adderall is dextroamphetamine or something like that. So these are also forms of methamphetamine. They're stimulants that help people with ADHD. But if you're caught with these drugs without a prescription, that is a Schedule 2 sort of drug offense. All right. Going here, these are now drugs that are, again, prescribable. But again, if you're caught without a prescription, it's a lesser offense, but it's still something that is a controlled substance. So codeine gets used quite a lot. That prescription dose, it's like a really strong dose of it, usually used for cough suppressant. You got ketamine, which is interesting because this is being used for a lot of different things, but for a while it was like a designer drug people were using called Special K. And if I'm not mistaken, I could be wrong, but my memory, ketamine is something that was originally developed as like a horse tranquilizer or something like that. And it's now become something that's used in all kinds of stuff. Even psychologically, there's been lots of cases of people using ketamine to help treat certain kinds of disorders that we'll talk about later. And things like steroids and testosterone too, that these are things that are Schedule 2. You can be prescribed, but you can't have it without prescription. And again, you get to Schedule 4, you got things like Xanax and Soma, Darvon, Darvocet, Valium, Ativan, Talwin. Talwin's another sort of pain medication. I think it's in the opioid family, but it's just a lesser one. Ambien's one that causes sleep. You got Tramadol. Tramadol's another interesting one because it's an opioid. No, I think it's a synthetic opioid that together, Tramadol and fentanyl. Fentanyl is, we'll talk about shortly, is one of the leading causes of the opioid crisis that we're in currently. But tramadol is another one that oftentimes gets sort of overlooked, but it's also contributing to the sort of opioid. So even though it's a less addictive drug, it's still contributing to addiction and overdose, like death by overdose from opioid drugs. Anyway, and you got Schedule 5, or Schedule 5 generally is where you have stuff that's like over the counter. So like Robitussin with codeine, Lomotil, Modafinil, Lyrica, Parapectilin. Those are, you may or may not have heard of those drugs, but like Lomotil, Modafinil or Motofin, and Parapectilin, those, if I remember correctly, those are all drugs to treat, they're like anti-diarrheals, diuretics, what do you want to call it? They stop your diarrhea. And then Lyrica is an interesting one. It is a drug that was developed it helps to treat like nerve damage, some types of seizures and other kinds of disorders around your nervous system. So it's a bit different. These other ones going to be more about, like Schedule 5, generally they're drugs that either are stopping your cough or treating diarrhea. Those are generally the Schedule 5 types of drugs, with this exception of Lyrica that seems to be doing some other stuff, and it could be I think got over the counter potentially. I say that potentially because it differs somewhat. This is based on the federal regulations, but it differs state by state. So for instance, something that's not on here that we can talk about, and I didn't put on it because it's sort of not clear, is something like ephedrine or pseudoephedrine. So this is an interesting case. I'm going to write it down here, where we have pseudoephedrine. Let's drop that. Ephedrine. So pseudoephedrine is a drug. Sometimes it's just ephedrine, sometimes it's different chemical compositions, but pseudoephedrine is a drug that you find in things like decongestant, like sinus pills. If you take like an allergy pill, the decongestant, pseudoephedrine is the controlled substance in those things. So the reason why when you go to buy, Sudafed with like a decongestant in it that's behind the counter, but you don't need a prescription for it. But the reason why they track your license and they make you sign for it, and you can only get like once a month and all that kind of stuff like that, is because this is a controlled substance. Now, the reason why is because the ephedrine part is chemically part of the equation that can be used to create methamphetamine. So even though ephedrine itself is not a Schedule II drug, it can be used to create a Schedule II drug. So it's controlled. Some states have pseudoephedrine and ephedrine as a Schedule III, so you have to have a prescription to even get it. In California, it used to be that way. You used to have a prescription to even get to get this. And I believe now, and again, I'm not 100% about this because I was trying to look this up and I can't find a definitive answer on it, but I think now the pseudoephedrine is moved to a Schedule 5 drug in California because you can get it without a prescription. It's behind the counter in the pharmacy, but you can get it over the counter. I mean, you don't need a prescription for it, but it is controlled. So it's an interesting Schedule 5 type zone. It may not be technically classified as a Schedule 5, but it functions very much like a Schedule 5 drug in California. There's other states too that do it that way, and some other states that actually have it as a Schedule 3 where you still have to have a prescription to even get it. And it's one of those things, if you're caught with large amounts of this, even, at any point, you could be arrested for the intention of creating methamphetamine. Now, what about the term narcotic? This is another, some terminology around drugs that I always found kind of confusing, and I think it's still a little bit confusing because what it originally meant and how it's used, I think, differ quite a lot. So a narcotic is the way it gets used, I think, more conventionally, is that a narcotic is any controlled substance which produces insensibility or stupor, right, and applies especially to opioids. But oftentimes you'll hear people talk about narcotics and actually be referring to drugs that aren't necessarily an opioid. Like they're not talking about heroin, they're not talking about morphine, they're talking about something else. So I think in some senses, people will use the term narcotic just to refer to any illegal drug, right? So if the drug it's either, it's legal, it's illegal, or it's used off prescription, then that's a narcotic, right? The legal definition of narcotic drug under that Controlled Substances Act also includes other things like coca leaves and cocaine and this thing called ecgonine, which is it's a coca leaf extract that actually is somewhat poisonous in its form. It can be used to make other drugs. So it's interesting because the term narcotic gets used in such strange ways. It originally meant, like, it was another term for opiate or opioid drugs, but I think it sort of morphed into just being any illegal use of drugs or illegal drugs, period. And so they talk about those as being narcotics. It's not always clear. So if someone is using the term narcotic, maybe ask for some clarification. Did they mean strictly opioids? Did they mean just illegal drugs? Like, what are they talking about? Because it gets used off like a narcotics officer, right? Like if you run to a police officer that's a narcotics officer, they're not dealing in just opiates or opioids. They're dealing with in combating illegal drugs, right? So that's why I think the term has gotten a little gray in terms of what it means and what it specifically is referring to. And then I brought a little picture here, like typically, these are kinds of drugs with some handcuffs, because they're drugs that are considered illegal drugs in the sense of the law and the legal system. All right. So in terms of drug terminology, this is the last sort of terms we're going to learn before we actually start talking about some actual drugs. So there are different drug classes. Again, I said that drugs can be classified in lots of different ways in terms of agonists and antagonists, in terms of are they a hypnotic versus a euphoric versus a psychedelic. But we actually have classes of drugs, generally because of the general purpose for that drug, like what it's intended for. However, as we'll see, some drugs cross classifications, and there's one in particular that I'll talk about on its own because it does have at least some, and to a certain degree, because opioids are generally, they're drugs that affect the opioid receptors, but they cause pain reduction, pain relief. Depressants, work to depress the nervous system, to slow it down, to inhibit activity in the nervous system, where stimulants do the opposite. They are cranking up your nervous system, getting you to work faster, harder. Psychedelics, again, are those that were used to create artificial stimulation, to be able to see, hear, taste, touch things that aren't there, to creating perception without direct stimulation. And then we have this separate class that are just sort of a hodgepodge of things that are called inhalants. We'll talk about those sort of separately because they're interesting. They have some pretty dramatic effects, and these are things that lots of deaths and other problems have come about because of inhalants, because of the ease in which they're actually accessed. So we'll talk about those separate. And then one of the things that we'll talk about that's interesting is we'll talk about marijuana a little bit separately, not only because I think it's just one of the pervasive drugs, sort of like alcohol is, that it's fairly widely accepted that people use it, but also because it tends to have a little bit of everything in here. It can help, especially if there's CBD and stuff involved. It can actually help to reduce some pain. It's not really an opioid, but it can actually help to be an analgesic the way that opioids are. It actually can work to help to depress things that cause some sedation, but other types of or strains of it can act like a stimulant and cause people to be more awake and more alert. And if enough of it is taken, it actually can trigger some hallucinations. So it actually has a little bit of everything. I think in general, you see it often pigeonholed into being either a depressant or a psychedelic, depending on where you look. But I think, it has a little bit of everything in here. I mean, not necessarily the inhalants, but it has a little bit of the first four drug classes, and therefore I'm going to talk about it sort of separately. And there are other drugs too that cross, but I'm definitely going to talk about that as marijuana as the one that sort of crosses at least the first four drug classes in terms of what their intended use is.